Welcome to the 2023 NNLM Virtual Symposium on Health Misinformation. We're so glad you're able to join us today. I'm Sean Corning, one of the Education Outreach Coordinators with NNLM Region 7. We just have a few technical items to cover. All attendees have been muted, but we welcome your questions and comments and any discussion in the Zoom chat at any time. VFairs is providing technical assistance today, and then the NLM staff will be keeping an eye on the chat with me. Am I coming through for the other folks? Okay, good. All right. Yeah, if you want to chat, make sure you select everyone from the drop-down menu so that everyone can see them. If you would like to submit questions, please use the Q&A function. This way they'll be all collected together and they won't get lost in the chat. We'll answer these questions that you have at the end. We have a live closed captioner for this event. You can access the closed captions by clicking on the icon with 3 dots at the bottom of your Zoom screen and then selecting closed caption. If you'd like to share on social media, we encourage you to use the hashtag for the event HealthMisinfoNNLM. Before we get started, I'd like to share a little bit about who we are for those of you who might be joining us for your first session with us. The National Institutes of Health is the nation's leading medical research agency, and then the NLM is one of the 27 institutes and offices within the National Institutes of Health. It is the world's largest biomedical library and produces online resources like PubMed and Medline Plus. So NNLM, the network of the National Library of Medicine, so that's us, is the education and outreach arm of the NLM, and we work to ensure that health professionals and the public have equal access to health information and put on programming like this. And then the NNLM is made up of 7 regional medical libraries, 3 national offices, and 4 national centers, all of which work to provide training, funding, and engagement opportunities to our over 9,000 NNLM member organizations. So it's my pleasure to introduce Tenley Sablatzky, a medical librarian at the Undergraduate Medical Academy, Prairie View A&M University. Today, she'll be presenting Lessons from History, a comparative study of health information during the cholera epidemic and the COVID-19 pandemic. So with that, I'll pass it over to you.
Thank you. Hi, everybody. Thanks for coming to this presentation. Let me share my slides real quick. Okay, there we go. All right. All right, so a little bit of background before I jump into the actual study. I started this, the original study of just the cholera epidemics in London in 2019. In the summer, I was doing a study abroad program at the end of my library science degree in London, and I was working on a study of the cholera epidemics and health and misinformation during that time. And then, of course, in 2020, as you all know, some things happened, and I began noticing a whole lot of similarities between the 2 different events. So I was like, let me just take a look more specifically at what some of those similarities are. And I sort of expanded it a bit to include the COVID pandemic as well. So that being said, I'm gonna start off with just a little bit of background. Some of this I've touched on a little bit already. As I said, my original study was just on the cholera epidemic and how information and misinformation was disseminated and accessed and who had the health authority. And then I kind of expanded it from there. So some background just on the cholera epidemics for those people who aren't as familiar. First of all, I'm sticking just with, for the purpose of this study anyway, just misinformation in the cholera epidemics and COVID in London, just for the sake of having a comparable study sample. So the cholera epidemics in London basically hit in 4 waves. The first from 1831 to 1832, where 6,536 people died. 1848 to 1849, 14,137 were killed. 1853 to 1854, 10,738 died. And then finally, the last wave in 1866, 5,596 died from cholera. Now, these numbers, with a little bit of comparison, the Great Plague was significantly larger in 1665, 1666, with over 75,000 dying. And then, of course, the numbers for London for the COVID pandemic as of 2021 were 184,255 deaths. And that's just in London, of course. So it's there, based on that, the cholera epidemic was significantly smaller. The numbers in deaths pale in comparison. But what's striking is the mass chaos that exploded during the cholera epidemics, because nobody knew how to handle it. And there was a lot of misinformation and mistrust of authority during that time period that I think resonates a lot to the present day as well. So we're gonna kind of take a look at that. So in the cholera epidemics in the first wave, the health reform movement had just started in that same time period. So there was already a lot of confusion about who had the authority over health, which of course did not help for the situation. But the health reformers that were sort of in charge at the time, they overlooked any possible connection to good sanitation, clean water, and good health. Going back to the ancient Romans, London's water supply had been a cause of some pride for its inhabitants already, and that kind of stems a lot of the reason for overlooking the possible connection to the water. Instead, the main theory, leading theory at the time, was the miasma theory, which we'll talk a little bit more in a little bit. But that theory, again, it has been proven to be false. But at the time, it was the leading theory that people went with because they didn't want to imagine any possible connection to the water. But this pride led the nation down kind of a dangerous path of ignoring facts and reason for just protection of feelings and emotions. One of the quotes from a reference that, again, I'll show all the references at the end, is the fear of cholera in the 19th century came about ignorance. Indeed, there were various theories as to how cholera spread. So another consideration for the cholera epidemics is the major class divides of the time. They were very divided, and one of the main things is because cholera is a disease that affects the spread of affects sanitation and everything like that. The lower classes were obviously more susceptible, and the upper classes tended to look down on the lower classes, as especially those who caught cholera. Basically, the streets and cellars were piled high with excrement and trash, especially in the lower class areas. And the air took on a familiar smell, which is partly how the miasma theory, which involves particles spreading through the air, took hold. But again, they didn't have a way to recognize or deal with the problem. And the solution for most people, especially in the working class, was just to use whatever was available to them. And so a lot of that is where various theories and home remedies and stuff came into play, which people just trying to find any possible source of a cure. So more on the lower classes. Again, they didn't have access to any clean or safe drinking water because of the cholera. So they basically used whatever they could find, which often was the unsanitary water. People had no knowledge often of the poor sanitary conditions or what was going on, and that it would be hurting their health. And even those who did, they most likely didn't have another option. Many, but not all of the lower class members were illiterate or had some level of illiteracy. And the health officials did put out pamphlets, which at the time were called handbills, which are basically just a one-page flyer, usually like a bullet point list of facts and information about the about cholera and how to protect yourself. And I'll show examples on some slides coming up. But those tips kind of went unused, partly because a lot of the lower classes were illiterate and they couldn't read them. Partly because the people who were illiterate would often have other people translate them to them. And in that translation, things were lost or misinformation happened. And finally, just because the actual content of the handbills were sometimes more condescending than helpful. A quote from one particular handbill of the time would be, "It mainly depends upon yourselves whether if the cholera attacks you, you escape with your life or whether you escape with your life or not. Should you feel the slightest attack of diarrhea, seek medical aid immediately. Or when opposed to the first battle is won, excuse me, the cholera has 4 friends: dirt, drunkenness, slothfulness, and fear. It has also 4th grade enemies: pure air, cleanliness, sobriety, and courage. Keep yourself clean. What you have to eat, let it be the best and nutritious kind. A glass of pure water, and do not forget to appeal to him who watches over us." So lots to unpack there. Obviously, some of that is good advice, but obviously the lower classes who did not have access to clean water or nutritious food, what are they going to do with that? And that's where sort of the spread of the home remedies and just various other solutions kind of came about. So the mistrust of doctors and obviously the condescending like handbills didn't help in that regard. The confusion around a health authority to begin with did not help. And it ended up resulting that thousands of people lost their life, mostly either due to pride or stubbornness or lack of information. So the home remedies, typically they cycled around via word of mouth through families and friends. And a quote from one of the sources was, "What is lacking in many of these explanations and prescriptions is some measure of humility, some sense that the theory being put forward is still unproven. It's not just that authorities of the day were wrong about miasma, it's the tendency, unquestionedness, and the way they went about it." So they basically just clung to whatever theory they believed in, without any scientific basis for that. And even, as we'll see on this next slide, several of the more prominent health researchers were doing research and disproved the miasma theory, such as Benjamin Hall, but those facts were largely ignored because while they knew the miasma theory wasn't true, they didn't know anything better than that. So they didn't want that miasma theory is basically all they had to go on, and they'd rather have something than nothing. But basically, the miasma theory suggested that diseases were produced by unhealthy vapors rising from the ground or decomposition of materials. And people were understandably very eager to solve the problem, and so they overlooked the evidence, or rather lack of evidence, that there wasn't any scientific basis for the miasma theory, and they just clung to that for as long as they could. So at this point, probably most of you are already kind of drawing your own similarities to like the present situation, because there's a lot of things that are fairly obvious as far as the mistrust in authorities, the spread of misinformation, distrust between the classes. There's a lot to unpack there. But one of the main things to talk about in terms of current day information is the spread of misinformation digitally. Because while, as I'm sure you all know, the internet and digital information is a fantastic resource, it can be hard to regulate control over information. And it's made the spread of misinformation huge. Paying attention to the target audience for the health information is critically important, just to avoid the situation where, much like the handbills were created with good intentions for the most part, with decent advice, but if they had paid attention to the fact that the lower classes were largely illiterate, and actually took into account their perspective and what they had available to them, they would probably have created different kinds of resources. People who do not have the opportunity to contribute to decisions and actions that affect the health are less likely to be well in the first place when ill and are likely to experience less benefit from treatment, is a quote from the present day London Health Council. So that's sort of the main things. The takeaway here is really just focusing on what those differences between the two events are, London cholera epidemic and COVID epidemic, and acknowledging how they're similar, how they're different, how things have changed, and what hasn't changed. So we know misinformation ran rampant in the 21st century, leading a lot of individuals to follow dangerous advice, which they often paid for by death. Additionally, systemic divides between the working class and upper class Londoners just made working together as a community impossible, as many people of the authority were taken seriously. These factors, though they're specific to the 19th century London, are certainly relevant to the 21st century. Class divides are still apparent in their own way. There's still often a mistrust between the classes and politically, and there needs to be a way of addressing that in terms of misinformation. And misinformation digitally is possibly the largest threat, just because it's such a huge player nowadays in how people find and access information. So from there's a lot of unanswered questions, and I hope that some of you who are researchers of health information will take this into consideration, because there's lots of potential further studies on this in terms of what needs to be done to create better and more accurate health information for future generations and to keep people safe and healthy. So those are my things. This is my reference list, and I'm available for questions or anything else.
Oh, thank you so much for your talk. We don't have any questions that are in right now, but just kind of get us started, and just remind people, if you have questions, you can put them in the chat or in the Q&A section. But just to get us started, I had a question. When you've been kind of reading about the misinformation around the cholera epidemic, and then the attempts by like the health boards to kind of disseminate information about the pandemic, about the cholera epidemic, did you come across any kind of contemporary awareness that there was this misinformation that kind of viewed it in terms that could be comparable to the way that kind of current authorities, whether kind of health authorities from the government or just kind of people who are medical authorities, recognize that there's health misinformation today and are trying to combat it?
Yeah. So there were definitely, in some of the contemporary readings of the cholera epidemics, there's definitely an acknowledgement that there was a lot of misinformation. The more unanswered question is what would be to be done about it, in terms of going forward and to solve it for the future. But yeah, there was an acknowledgement now that there was misinformation. At the time, even there was acknowledgement from a lot of the health authorities, such as Benjamin Hall and others, that there was some of the theories, like the Miasma theory, were inaccurate and misinformation. But again, sort of pride kind of got in the way there, and people tended to follow the home remedies and other theories that were more prominent and led to what they thought was a cure right in the moment, instead of listening to facts or reason.
Okay, that makes sense. I'll give a couple moments for see if folks have other questions. All right, so I can read this one off, which just came in. Do you think doctors play a role in how seriously the public takes new information when it becomes available? In the case of the cholera epidemic, I feel like doctors were really unwilling to change their ideas about germ theory for decades and were part of the problem. Ignatius Semmelweis was left to rot in an insane asylum after he implemented hand washing into his clinic, for example.
For sure. I think doctors play a major role for the reasons you mentioned, and others. Yeah, doctors during the cholera epidemic, many of them were still presenting misinformation themselves. Some of them were new, like the Miasma theory and stuff were inaccurate, and were trying to promote that wasn't accurate and they shouldn't follow that advice. But nobody really knew what was accurate. None of the doctors at the time knew what was the correct solution. They just knew the Miasma theory wasn't accurate. But yeah, I definitely think doctors today and then play a huge role in how health information is relinquished and disseminated, in terms of communicating with patients and knowing the demographics, so they're presenting the information in an accessible way. And I think they play a huge role, to answer the question simply.
Excellent, thank you. And then another question came in. Why were home remedies thought to work over science? Was it a non-belief in the miasma theory, and then without kind of having a more accurate theory to replace it, or was it something else?
Yeah, it was mostly not having anything to replace it. Mostly the miasma theory kind of stemmed into home remedies for trying to keep yourself clean. Some people of the lower class, if it either hadn't heard of the miasma theory, or didn't know about it because information wasn't disseminated to them. But yeah, home remedies kind of stemmed just because people needed treatment that wasn't available to them. So they just kind of came up with whatever they could think of. And some of them were good, a lot of them were like herbal remedies for different ointments and creams and stuff like that. Mostly did not work. Some of them were crazier and resulted in death often, or more serious illness. But yeah, the home remedies, they kind of spread mostly really because there wasn't a definite answer for how to cure cholera, and there wasn't a clear spread of information. So some people were saying it's inaccurate, some people were saying it's accurate, and people didn't really know what to believe. At the same time, they or someone they knew probably had cholera, and they just needed something that would work. So they just kind of tried whatever was available to them.
So I'd like to, thank you all for coming, and thank you again for this great presentation, Tenley. For those of you who attended and are interested in claiming MLA CE credits, you'll receive an email with instructions after the final day of the event, which is tomorrow. Please join us for our next session in this room at 3 p.m. We encourage you to visit one of the booths, take a little bit of a break, stretch, something like that. And then we'll see you in our next sessions. Thank you so much, and thank you again for your presentation.